Welcome back. There's a potential to save out-of-pocket expenses with the Medicare Give Back program. And joining us with all the great details is Martha Clopin of Get to Insurance. Aloha.
Aloha, Kelly. Thanks for having me back.
Of course. So happy to have you back because you save our viewers a lot of money. So I love that we're talking about this. But first, let's get to the basics. What exactly is the Medicare Give Back program? And is it something that everyone on Medicare can take advantage of?
Kelly, I'm so glad you asked me that because a lot of folks get really confused because the Medicare Give Back program is actually a program that some Medicare Advantage plans offer. So not all Medicare Advantage plans offer the Medicare Give Back. They gave it that name so people associate it with Medicare, and there can be some savings, but there's another program we'll talk about today, Medicare Savings Program. That is the one that is sponsored by the government.
Okay, so what exactly is that then?
Yeah, that's a program that based on your income, household size, you can get savings of over $1,900 per year.
Wow.
So imagine all the people who need to find a way to get a little bit of money back because they were so generous for Christmas time and all those gifts. So this is a way that some people can get money back. So a lot of people are unaware of these savings programs. So that's why I wanted to make sure I shared it today. But I also have to give you a praise report.
Okay.
I must. Someone was listening to the show and thinking, oh, I'm close to Medicare age. I don't need any insurance. I'll wait till I turn 65, which was going to be in about 3 weeks. And they ended up in the emergency room and needed to be hospitalized. But they have been listening to the show a month or so ago, and they received the gift of insurance. So whew, they had insurance. I can't believe it. She called me to say, Martha, oh my gosh, I never get sick. And I got sick and I had insurance because I was listening to Living 808.
Love that.
And someone picked up the gift of insurance for me.
Thank goodness.
And I mean, this was 3 weeks the person was qualifying for Medicare insurance. So they thought, chance them, right? You take a chance. But it's never a good idea to take a chance and go without health insurance. So that's why I enjoy sharing information about insurance with you.
Definitely. And let's keep sharing information because these savings programs, they sound like they could be really beneficial. So how do folks apply for one of those government Medicare savings plans? Because it can reduce the out-of-pocket costs, right?
Yes, it's so easy. They need to just make a phone call. You call Social Security, and we put the number up. It's 1-800-772-1213.
Okay.
So that number will be, I'm sure, on your website. But what's important about that is a lot of folks are afraid to make that phone call. But over the last few weeks, I've been calling Social Security with people, and we get through really, really quickly.
Oh, good.
So I don't want anybody to be afraid to access the Medicare savings programs because they're afraid to make a phone call. But you can actually apply online as well. You go to ssa.gov or just make that phone call to the Social Security Administration.
Perfect. Yeah, don't be intimidated by the national numbers. I know a lot of times when we're put on hold, it can be a pain, but something like this, definitely worth it. But let's talk about who can actually apply. What are the income or resource limitations?
Right, that's a great question. Well, this is for Medicare beneficiaries. So Medicare beneficiaries must meet some income and asset requirements. But for, state of Hawaii, they're a little bit higher than the national amounts. We're over $2,000 for a married couple. So that's why it's important to call because these programs also, every year, they might increase the amount of income you can make. They might increase the assets. So it just makes sense to make the call. I mean, they can only say no. But I think it's important to make calls for your loved ones because many people who are in their 70s and 80s, their Social Security income might be kind of limited. So they may be excellent for this, but anyone who meets the income, asset requirements, and also has Medicare can apply for these Medicare savings programs.
Wonderful. And when they do apply, well, first off, how do you apply? And then second, how much can you save?
Right. So they can apply either by making that phone call to the Social Security Administration or they can go online and fill out an application. But you can save over $1,900 a year. I mean, that could pay a cable bill.
Yeah.
That could pay for something. That could pay a utility bill. So I think that's a savings that's really worthwhile. It's worth making that call. But I think also, Kelly, what's really important, people understanding you want to stay insured. You know, there are some affordable ways to get coverage. A lot of folks think, oh, everything's so expensive. But there are savings programs programs designed for folks who need some assistance. And I just want to say, you know, my heart goes out to the folks who were traveling over here and got a little bumpy on the, you know, the ride over. But you see, everybody needs insurance because those folks were just taking a trip and ended up needing to have a little emergency room attention. So it's so important to have health insurance for when these unexpected things come up, even if you've been healthy all your life.
Yeah.
So I'm so happy that you folks allow me to come on. And I got to tell you, I hear from, I'm not exaggerating, dozens of people.
Awesome.
I was watching Living 808.
Yeah.
They're all watching you guys.
Oh my gosh. Well, of course, we love to have you on, and we love that you save our viewers so much money. So thank you for all that you do. And we'll have a link to the website on our website at kh12.com, as well as the phone number, and then, of course, the link to Get to Insurance. Thanks so much, Martha,
Thanks,
for being
Kelly.
here. All right.